Now, when you've got the exciting news that you were about to have a baby, you just want to tell the world. But we want to talk about the right time to deliver that news. Please welcome Dr. Marjorie Dixon, our women's health specialist, to talk about this. It's such an exciting time in your life. You know, you've been through it 3 times.
I know.
And you're ready to burst. You're so excited. But it's not the sort of news that you should just willy-nilly be telling, you know, the day after you pee on the stick,
No,
right?
Absolutely not, because people don't realize how frequent miscarriage is, and it's devastating. Even if you have one miscarriage, it's hard to deal with.
Yeah.
And then, you know, people need to understand the frequency of it, and then what are the risk factors for it, so they know what to expect. And if it does happen, they aren't entirely taken off guard.
So how common, do we actually have stats on miscarriage, how common they are?
So 8 to 20% of
Yeah.
clinically recognized pregnancies. So once you've had that early ultrasound, you know that you're pregnant, 8 to 20% of those confirmed end up in miscarriage. And of those 8 to 20%, and this is the important part, that 80% of them happen in the first trimester.
Right.
Okay, so that means that the vast majority of them happen before 12 weeks. So once you get that ultrasound, people feel like exuberant, which is understandable. So you want to be able to tell everybody I'm pregnant, especially in the population of patients that I see, especially the infertile population. They really want to be able to share that news. But you have to be cautiously optimistic, because there is the risk of miscarriage. And if you are infertile, if you've been struggling to get pregnant, the likelihood of miscarriage is slightly greater as well.
Oh, so you got to keep it under wraps. I always wonder in Hollywood, and I guess it's because they are constantly looking for a baby bump, but I feel like they tell the news really quick, and I feel like you're throwing some caution out there against fate. Delivering that news so early.
People are often speculating and are wrong, and I think that's something that needs to be said. Don't ask someone if they're pregnant ever.
Never.
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 Not a good thing.
No.
They could have bloating. They may have gas. It's not, or they
don't.
might just have gained a few pounds. It's not a good thing.
Wait till the baby is coming out of their canal.
Well, let them.
And then you can ask. Honestly, it's never the right time. You have to wait until they have actually said
and
something.
you never know what experiences a woman has had with pregnancy, potentially infertility, and maybe prior miscarriage. So I think it's important for women also to understand that maybe you do want to share the news. Maybe for you it's super easy to get pregnant and all your pregnancies have been perfectly normal. But you need to be mindful of what someone else's experience might have been. And think about how it would feel if someone went off about how easy it is to get pregnant, and I'm pregnant again and now I'm going on. If you have just maybe experienced a miscarriage and are being very private about it.
That's right.
Right?
Now you say age plays a role in this as well, when you should tell the news.
Yeah, so, well, the likelihood of miscarriage increases with advancing maternal age. So that means that, for example, if you're 20 to 30 years of age, your likelihood of miscarriage is 9 to 17%. It's on the lower end. By the time you're 35, it's 20%. By the time you're 40, it's 40%, which is big. And then age 45 years, 80% of clinically recognized pregnancies end up in miscarriage. So that's the vast majority of them. So as you get older, we've talked about aging and fertility, and because it's harder to get pregnant because of the quality of the eggs. So when eggs are poorer quality, you're less likely to be able to have a good chromosomally euploid or normal pregnancy to progress to term.
Okay, so let's say you're keeping this information inside, but you work in a job where you're in a stressful environment, or an environment that is not good for pregnancy. You know, maybe you're doing heavy lifting at your job. Maybe you're around toxic substances at your job. What do you do about that?
Well, there are 2 things. So the toxic substances, if you know that there's potentially risk to pregnancy, especially in early pregnancy when organogenesis are forming the organs and whatnot, it's important to be able to speak to someone and if you don't want to tell the entire universe, you can speak to someone in human resources. They have a responsibility to support you as their employee. That's one thing. And they do not have the right to advertise your pregnancy to anybody else. It's between you and whoever's responsible for your employer, so your boss or the human resources department of your work. So that's one. So you don't really need to care, and it's nobody else's business, even though they may seem to care, what's going on if you change your responsibility at work. Number 2, if it's difficult around you in as much as strenuous work and lifting, you shouldn't be doing any heavy lifting, especially if you've had a history of previous miscarriage or difficulty, or if you're bleeding in pregnancy. The #1 sign of miscarriage actually is vaginal bleeding. So if any of this happens, speak to your physician first, and we can provide you a letter. And even if you don't want us to say, you know, Dr. Marjorie Dixon, fertility specialist or gynecologist, for medical reasons, this person should be limiting their activities. And often we are asked to fill out whatever forms for insurance purposes, and we're more than happy to do that. We, as your primary health caregivers, your family doctors, your gynecologists, whoever, want you to be able to have the most stress-free pregnancy and minimize the risk that you will miscarry if we can. So you really need to have some person, one person that you can confide in, and they will help you, they will give you the information that you require to get to that.
Right, because part of the issue there is that you don't want to, let's say everything goes okay. You don't necessarily want your bosses or your supervisors to know what's happening on your personal level, because it could affect how they see you in your job, right? Which is why so many women wait so long before they say anything. For you on a personal level, well, you run your own business. So you didn't have to tell anybody.
I didn't. People ask me right away, because as soon as I'm a little bit pregnant, I get really big. But honestly, I tried to conceal my pregnancy for as long as possible, because I have to be sensitive also to my patients. I work in an office where I help people to conceive, right? So most of the time my patients just thought I was heavier. They didn't really know. I advertised that I was pregnant probably 7 months out, when I couldn't hide it, because I wear a lab coat too. I get like a cot, so I was able to. I had the good fortune of being able to conceal it under my clothing. It's a tough one for people at work, and I think that as women we need to learn to support one another better.
Absolutely.
And if we do find out that somebody else has a pregnancy that they're not advertising, instead of talking to other people, try to put yourself in the place of the other individual and support one another through it.
Yes, and check your workplace policy. It never hurts to know what the rules are.
The rules
Look
and
at the
regulations.
fine print,
HR.
what they can't. That's right. HR,
Human
go through
resources.
those rules. Thanks for the tips.
You're welcome.